Hi, my name is Taylor. I'm going to be your nurse today. We're going to do a head-to-toe assessment just to check your overall well-being. I performed hand hygiene. Can you tell me your first and last name?
Chris Holmes.
And your date of birth?
9/20/70.
Okay. Do you know where you are?
West Deptford, New Jersey.
Okay. And what are we here for? Why are you here?
Assessment.
Okay. Can you tell me who the president is?
Donald Trump.
Okay. So he's alert and oriented ×4. He's clean, well-groomed, dressed appropriately. His posture is erect. His body movements are smooth and coordinated. His facial expressions are relaxed and appropriate for the situation. His speech is clear, normal, rate, and not slurred or jumbled or anything like that. His mood appears calm and cooperative, and his thought processes are coherent and logical. Throughout the assessment, I will be assessing your skin for color, temperature, turgor, any lesions or swelling. So we are going to start with your head. Have you been experiencing any headaches recently?
No.
Okay. Any scalp tenderness?
No.
Okay. So first I'm going to inspect it and then I'm going to palpate. It looks, I don't see any abnormalities, no lesions. I'm going to palpate.
Mm-hmm.
Tell me if you feel any tenderness.
No.
Okay. Hair is evenly distributed. I don't feel any lumps or bumps. And his scalp does not look dry. I'm going to inspect your face. Symmetrical, no drooping, no involuntary movements. Can you smile for me? Can you frown? Can you raise your eyebrows? Can you show me your teeth? And then can you puff out your cheeks? Okay, and then I'm going to test sensation on your forehead, cheeks, and chin. So just tell me how it feels. So.
Pointy, sharp.
And you feel that?
Yes.
Okay.
Soft.
And then you feel it on both sides?
Yes.
How'd that feel?
Ticklish.
Okay,
And
perfect.
soft.
Okay, I'm going to check your sinuses now.
Okay.
So tell me if you feel any tenderness. Maxillary sinuses. Any tenderness?
No.
Okay, frontal. Any tenderness?
No.
Okay, perfect. They don't feel swollen. I'm gonna pop out your temporal arteries. Any tenderness?
No.
Okay, and a good elasticity. I'm gonna pop out your temporomandibular joint. So I'm gonna feel, and then can you open your mouth? Okay, you can close it. Okay, smooth, no clicking. Right. Next we are gonna check your eyes. So have you had any recent vision changes?
No.
Okay, and do you wear contacts or glasses?
I wear contacts.
Okay. If I had a Snellen chart, we would be testing his visual acuity. I'm gonna inspect your external eyes. They look good, no abnormalities, not dry. And then I'm gonna look at your internal eyes as well. I'm gonna pull it on here. And no tenderness or pain in your eyes?
No.
Okay, the conjunctiva is pink, your scleras are white, clear corneas, and your irises are evenly colored. I'm going to check your peripheral vision. So I'm gonna put numbers on my fingers, you look at me, and you tell me what you see in your periphery.
2. 2. 1. 1.
Okay, now can you cover your right eye? I'm gonna cover my left. You tell me when you see the object come into vision, okay?
See it. See it. See it. See it.
Okay, other eye?
See it. See it. See it. See it. Ooh, so sick.
Okay. Now I'm gonna have you look at me.
Mm-hmm.
I'm gonna put my finger, you keep your head still, but follow my finger with your eye, just your eyes. We're gonna do the 6 cardinal positions of gaze. Perfect. Okay, I'm gonna use my pen light now to look at your eyes. You look at my nose. Okay. These pupils are equal, round, reactive to light and accommodations. And then I am going to dim the lights and just light reflex. Okay. You're gonna look into the light, okay? Okay. Corners are even. I'm gonna put another stuff on. Okay. We're going to move on to your ears. I'm gonna check out any hearing changes recently.
No.
And do you wear any hearing aids?
No.
No. Okay. I'm gonna inspect. Okay. Ears look good. No drainage. No swelling or redness. I'm gonna palpate the auricles and the lobule and your tragus. Any tenderness?
No.
Okay. No lumps or bumps or lesions that I can feel. I am going to also palpate the mastoid process, which is right behind your ear. Here. Any tenderness there?
No.
Okay. No lumps or bumps. Skin is intact.
Oh.
Okay, and then if I had an otoscope, I would be looking in his ears to look at his tympanic membranes, and they should be pearly gray. Next, we are going to do the whisper test. So you're going to, on this ear, you're going to, actually, I'll do it. I'm going to whisper a word, and you tell me what you hear, okay?
Okay. Apple. Banana.
Okay.
Cat. Dog.
Okay, perfect. All right, next we are going to be doing your nose and your sinuses. So have you had any like pain in your sinuses recently?
No.
Okay, and any drainage or nosebleeds?
No.
Okay, perfect. I'm going to inspect the external nose. No deformities, it looks even and symmetrical. No deviation of the septum. I'm going to palpate your nose now, okay? Tell me if you feel any tenderness.
No.
Okay, we're gonna check the patency of your nostrils next. So I'm gonna have you occlude one nostril and then breathe out. Okay, you can hear airflow, other one. Perfect, so your nostrils are patent. And then I'm gonna take a pen light and look at your internal nose. Yeah, you can look up just so it doesn't get too much in your eyes. Okay, perfect, no redness or drainage or any deformities of the internal nose. No swelling, pink and moist. Okay, next we are going to do your mouth and throat. Have you had any trouble swallowing recently?
No.
Any lesions or ulcers in your mouth?
No.
Okay, great. I am going to inspect the inside of your mouth. You can open up and I'll look. Look at the buccal mucosa. It's pink. His teeth look good. There's none missing. Okay, can I see your tongue? Okay, tongue looks pink. Okay, and I'm gonna have you open again and you're gonna say ah, just so I can check your uvula.
Okay.
Okay, the uvula is rising midline. This particular patient doesn't have tonsils, but if he did, I would take a look at his tonsils as well. And I am gonna also check your gag reflex. There we go. Okay, perfect. All right, next we're gonna move on to your neck and your thyroid. Have you been having any neck pain recently?
No.
Any lumps or bumps that you have felt?
No.
Okay, I'm going to inspect his neck to make sure it's symmetrical and there's no visible lumps. Which it does look to be symmetrical. Okay, now we're gonna do range of motion. So can you look up and down? Side to side. And can you shrug your shoulders? Okay, and we're gonna do it against resistance now.
Okay.
So if you try to look up. Okay, down. Okay, side. Other side. Now show your shoulders. Perfect. Strength is there. We are going to palpate your lymph nodes next. So first I'm going to do your pre-auricular right here. Post-auricular. Occipital, which is in the back here. Let me feel any tenderness as well. And skin is intact in all these regions. Tonsillar, submandibular, and submental. Okay, no swelling. They're non-palpable. I am going to palpate your trachea. Just any tenderness?
No.
Okay, his trachea is midline. Perfect. And next I'm going to palpate your thyroid I'm going to go just behind you a little bit. Any tenderness?
Nope.
Okay. No enlargement there. I'm going to next palpate and then I'm going to listen also as well to your carotid arteries. So it's trachea. Okay, going to take a listen. Okay. No bruits. Perfect. Okay, so moving on to your upper extremities now. Have you been having any issues with range of motion with your upper extremities or anything like that?
No.
Any pain recently?
No.
Or weakness?
No.
Okay, perfect. I'm gonna inspect your arms, your hands, and your shoulders just to make sure your skin looks intact. I'm not gonna uncover him just for patient privacy reasons. But have you noticed any lesions or anything like that on your shoulders?
No.
Skin looks intact everywhere, no lesions that I can see, or swelling. I'm going to check your capillary refill in your hands, in your fingers. Okay, less than 2 seconds bilaterally, that's perfect. I'm going to palpate your joints just to make sure there's no tenderness or crepitus. Okay. Any tenderness there?
Nope.
Perfect. All right, I am going to also palpate your brachial pulse. Okay, pulses are even and regular bilaterally. I'm going to test your range of motion and muscle strength in your hands. So if you could just stand up on your upper extremities. All right, if you can raise your arms like this. And if you can put them back like this, and put them behind your head. Can you cross your hands behind your back like that? Okay, perfect. All right, you can sit back now. All right, so if you put your arms out like that, I'm gonna push up, try not to let me, okay? Okay. Good. Perfect, and then if you can just squeeze my fingers, both hands. Okay, strength is 5 out of 5 and range of motion is good too. And then let me check just your skin turgor. Okay, immediate recoil and his skin is intact. No lesions or swelling or ecchymosis or anything going on. Okay, next we are going to move on to your posterior chest. So if you can stand up and turn around. Okay, and then you could just breathe normally. I'm just inspecting to make sure there's symmetrical movement with respirations. And there is. Again, I'm not going to uncover him, but is your skin on your back intact? No lesions or lumps or bumps or bruising?
No.
Okay, perfect. I am going to palpate for symmetrical expansion when he breathes. Okay, breathe. One more. Perfect, symmetrical. And I didn't feel any lumps or tenderness when I touched him either. So I'm gonna touch your back again, and I'm checking for tactile fremitus. So can you say 99?
99.
Again?
99.
One more time.
99.
Okay, perfect. The vibrations are equal bilaterally. Now I'm going to percuss. So. Okay, and resonant sounds with percussion. And now I'm going to auscultate your lung fields. Can you see all this in the?
Mm-hmm.
Okay. I'm going to listen with my stethoscope.
How much time? Or-
You're good like this. And when I move my stethoscope, you can take a breath each time, okay? Okay. Yeah. 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 Again. One more. Okay. Lung sounds are clear bilaterally. Perfect. Okay, you can sit back down. All right. So we are going to move onto your anterior chest. So do you have any shortness of breath or anything like that?
No.
Any chest pain?
No.
Perfect. Okay, so I'm going to inspect just to make sure you don't have any accessory muscle use and you're not having labor breathing, which doesn't look like you are. Your respiratory pattern is even. I'm going to palpate again in the front to make sure I feel, the same. Okay, take a breath. Okay, symmetrical expansion is even. I am going to auscultate now. I'm going to listen to your lungs in the front.
Okay.
Take a breath. 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 Listen to your sides. And take a breath. Okay, lung sounds are clear. Perfect. Again, I'm not gonna uncover him, but do you feel any tenderness, any lesions on your skin, bruising?
No.
Okay, perfect. Okay, I am going to I'm gonna do the same thing where I touch you and have you say 99 again. So,
Okay.
okay.
99.
Okay.
99.
Okay.
99.
Okay, vibrations are equal on both sides, and I don't feel any lumps or tenderness. Okay, moving on to your cardiovascular system. So do you have any history of any heart issues or anything like that?
No.
Any palpitations?
No.
Nothing like that. Okay, perfect. I am going to inspect for your apical impulse. So that is down here.
Mm.
It's in your 5th intercostal space, midline. Okay, and no tenderness?
No.
Okay. I am going to palpate your left sternal border of your heart and the base. Any tenderness?
No.
Okay, perfect. No, I don't feel any lumps or bumps. Everything feels even. I'm going to listen to your apical pulse. In reality, I would listen for 1 full minute, but I'm going to listen for 15 seconds and multiply it just in the interest of saving time. Okay, it was 15, so it would be 60 if it was for a full minute. I'm going to listen now to your different heart sounds.
Okay.
Aortic, pulmonic, Herb's point, tricuspid, and the apex. Okay, S1 and S2 were audible with no extra sounds in there. And then I'm gonna have you lie on your left side.
On the left side?
Yes. And I'm gonna listen to the apex of your heart that way. Make sure we don't hear any extra sounds. Perfect. No extra sounds there. All good. You can sit up.
Sorry.
Okay. We're gonna move on to your abdomen. So if you could just sit, you don't have to like lay, but just sit back like with your, yeah, that's okay. Okay. Do you have regular bowel movements?
Yes.
Any stomach pains recently?
No.
Perfect. Okay. From what I can see, your stomach is flat. No skin issues, no tenderness.
No.
Perfect. Okay, I'm gonna listen to your bowel sounds now.
Okay.
Okay. Bowel sounds are active in all 4 quadrants. I'm gonna percuss now. Resonant sound heard, and there's no tenderness, right, in your abdomen. Okay, I'm gonna palpate. Okay, perfect. It's soft and non-tender. Right. Okay, we're gonna move on to your lower extremities now. Do you ever feel like you have any swelling in your lower extremities or anything like that?
No.
Any pain walking or?
No.
Okay, perfect. Okay, so I'm inspecting. They look symmetrical. Everything good skin-wise, skin intact?
Yes.
Okay, I'm just gonna look and just make sure you have normal hair distribution just down here. Okay, perfect. No tenderness, skin is intact there. I'm gonna have you just sit like forward a little bit like you were before. I'm gonna palpate your hips, your knees, your ankles, and your feet. Any tenderness?
No.
Okay, put your hands. No tenderness?
No.
Okay, put your feet out. Okay. All right, no tenderness, skin is intact. You can keep your legs out if you want. I'm gonna palpate some pulses. So I'm gonna do the popliteal behind the knee. Okay, the posterior tibial. And then the dorsalis pedis. They're +2, even, strong, and equal. I'm gonna check cap refill on your toes. Less than 2 seconds, good. And then we're gonna test range of motion and strength. So if you wanna lay down again, I'm gonna test range of motion of your legs.
On
Yes. On your back.
My back.
Okay. You have you bend your knees. Yeah, you can do one at a time. You can do one at a time. Okay. And on this one. Okay. And if you could just lift up. Straight. Yep. Good. Lift up. Okay, now try and lift up. Okay. Okay. Push against my feet. Push against my feet. I mean my hands. Push up. Up. Okay. Can you feel it? No numbness, tingling, or tenderness? Okay. You can sit up. Full range of motion. Strength 5/5. Moving on. Okay. We are going to next do neuro. So do you ever feel like you have any numbness, tingling?
No.
Anything like that? Any forgetfulness?
No.
No. Okay. I'm gonna check sensation everywhere. So, you know,
Okay.
just you feel that. I'm gonna do your face, arms, legs, feet.
Feel it.
Legs, feet.
Feel it.
Okay, now I'm gonna have you close your eyes, put your hands out, and tell me which way I'm moving your fingers.
Up. Down. Up.
Okay. All right. Now we're gonna test for stereognosis. So you're gonna put your hands out, you're gonna close your eyes, I'm gonna place an object in your hand, you're gonna tell me what it is.
Okay.
Okay. Yeah, put your hands out.
Can of soda?
Okay.
remote control.
Mm-hmm.
Pen.
Perfect. Okay, now we're gonna test for something called graphesthesia. I'm gonna write numbers in your palm with your eyes closed. You're gonna tell me what number.
Just one, huh?
It's fine, yeah. Close your eyes.
2, 6, 4.
Good job. Okay, I'm gonna test your cerebellar function next. So I'm gonna stand here. I'm gonna have you touch your finger to your nose and then touch to my finger. That same finger.
Oh.
Yep.
Okay. Sorry.
Okay, one more time. Good job. Okay. Next I'm gonna do reflexes. So I'm gonna have you. Okay. Ready?
Mm-hmm.
You can bend your arm a little bit. Okay. I'm gonna pull this over. I'm gonna have you sit on the stool really quick just so I can check your patellar reflexes.
Okay.
Perfect. Okay, you can sit. Reflexes are present. Okay. And then, yeah, they're +2 symmetrical on both sides bilaterally. Now I'm gonna have you lay again one more time, sorry.
On my back.
Yeah. I'm gonna have you take your heel and rub it up your shin. Test cerebellar function, yep. And then same thing on the other leg. Perfect, okay, you can sit up. Actually, stay like that. I'm gonna test your venti reflex while you're laying.
What am I doing?
Nothing. Perfect, negative. Okay, and then you can sit up. I can't see his spine with his shirt on, but from what I can see, the way he's postured and everything, no sign of scoliosis or any curvatures. And then I'm gonna have you stand up and walk just so I can observe your gait.
Just walk.
Yep, just walk normal. Okay, good.
Back.
No trouble walking.
Nope.
Perfect. Okay, now I'm gonna have you do a tandem walk. So you're gonna walk heel to toe, like that.
Okay.
Perfect. Okay. Last a couple things. I'm gonna have you hop. You hop on one foot.
Okay.
Okay, one other foot. Perfect. Okay, and then we're gonna do something called the Romberg test. So you're gonna stand with your hands to your sides and your eyes open. Okay, simply stop. Stop. Now close your eyes. Perfect, no swaying. Okay, well that concludes our assessment. Any questions for me or concerns?
No.